Today is the last day of Gun Violence Awareness Month, and we are talking with two experts about a new life-saving policy in Virginia that could prevent gun suicides. Right now on CSGV at Home. Hello and welcome to CSGV at Home. My name is Andrew Patrick and I am the Director of Political Communications at the Coalition to Stop Gun Violence. Today is June 30th. It is the last day of Gun Violence Awareness Month of June. And we're going to be talking about a policy that not a lot of people in the movement and outside the movement are aware about, and that's voluntary self-prohibition of firearms. So I'm so happy today to welcome Professor Fred Vars of the University of Alabama School of Law and our Director of Strategic Communications, Bryan at the Coalition to Stop Gun Violence. I want to thank you guys for taking the time.
Thank you.
Yes.
So, but like I mentioned, Professor Vars, voluntary self-prohibition, not a lot of people know about it, but it is starting to make some waves in certain state legislatures. Can you explain a little bit about what this policy is and how it works?
Absolutely. So I think the big thing to keep in mind is the scope and magnitude of the problem. So over 20,000 Americans each year die by gun suicide. Many of those involve a recently purchased weapon, which is consistent with finding about suicide often being impulsive. The idea with self-prohibition is that an individual sometimes knows they're at risk of suicide, and they have the opportunity to sort of confidentially, voluntarily put their name on a list so that a gun dealer wouldn't sell them a firearm during a time of crisis.
Yeah. I mean, it's something that we've talked about. Bryan, you've co-authored some pieces with Fred about this. You've written about this, and you've spoken up about how you would sign up for this type of policy on this type of list if it was available in your state. Can you just explain a little bit why?
Yeah, so I live with bipolar disorder and I am prone to periods of suicidality during my episodes. Like many other people with mental illness, my illness is episodic, meaning that I have periods where I'm well and able to talk to you and be here and have no problem functioning. And then I have periods where I'm not well. And when I am experiencing suicidality, it really turns me into someone that my healthy self barely recognizes and really scares me. And as Fred mentioned, we know firearms are the most lethal suicide attempt method in the United States. So having a gun or being able to easily buy a gun during those times of suicidality, when I don't feel like myself, is really dangerous for me. So for me and other people like me in states where this policy exists, it gives them protection from the unwell version of themselves who might not make the best decision when it comes to purchasing a firearm. I think there's a misconception that people with mental illness can't make decisions for themselves and can't make decisions about their own health, but many people with mental illness can make informed decisions about their well-being and prevent themselves from accessing things like firearms, which are extremely dangerous when they're unwell.
Yeah, I mean, absolutely. It's an important policy that I think will gain more recognition and more people will learn about it and hopefully goes into further use. But Professor, you've done a lot of the research on this type of policy, especially conducting a study on people's willingness to sign themselves up for such a list. What were some of the results of that study? What did you find out?
Yeah, absolutely. So at this point, I've done 3 studies. The first one was among a population of individuals seeking psychiatric care. So at higher risk of suicide, presented them with the option, if this were available in your state, would you sign up? 46% of that surveyed respondent group said they would sign up to self-restrict their ability to purchase a firearm. So that's a huge number, right? Because there are obviously millions of people struggling with mental health problems in the country. In 2 follow-up studies of kind of broader samples of just kind of the general population, we get sign-up rates around 30%. So not as high as the 46, but still really encouraging because, mental illness is often a trigger for suicide, but it's not the only trigger. People have alcohol problems or relationship problems, or, if they've decided in advance to kind of take guns off the table in that moment of crisis, then they can really prevent their lives, prevent a fatal suicide attempt. The other thing I want to say about the policy, I should have mentioned this at the outset, there is an option in all of the 3 states that currently have this policy to change your mind, to say, look, I want to go hunting with my nephew, or I'm feeling fine, or I'm stable on my medication and have been for years. I want back my ability to buy a gun. There's a way to get off the list. In each state, though, there's a waiting period to make sure you're really thinking clearly before you get back access to, or easy access to a new firearm.
Yeah, I mean, thank you so much. That's an important. What states are these? What are the 3 states?
Yeah, so the 3 states, Washington State, it's been on the books the longest, and it's going into effect soon in Virginia and Utah. So those are the 3 states that have it. We've had, bills introduced in over a dozen states at this point, actively pursuing legislation in 2 or 3 at this moment.
Yeah, it goes into effect tomorrow, July 1st, in Virginia, and you said very soon in Utah. Virginia is probably the largest population who's going to have access to it. I don't know, but what is unique about Virginia's law that just passed in their session 2 years ago?
Yeah, so what's really great about Virginia is in order to sign up, in both Washington and Utah, you have to go to the county clerk's office and fill out a form, present ID, and sign up in person. In Virginia, you can sign up by mail. And so all you have to have is, a copy of your photo ID, drop it in the mail, and you can get yourself protected. And I think it's been a barrier in, Washington State. Some county clerk's offices didn't know about the proposal. It's the pandemic. Who really wants to go in person and stand in line at the county clerk's office, right? So having that mail-in option in Virginia, I think is a terrific innovation. Yeah,
certainly an opportunity just to save lives by making this a simple process with the mail-in option. Bryan, what's it going to take to make people aware of this policy and get them to use it? And what would you say to people who are consider taking advantage of this policy in these states?
So I think, like with any other law, and especially, Andrew and I work in gun violence prevention, we've seen with other laws that really robust implementation is key in these cases. I think, as Fred mentioned, making sure that the key stakeholders know about the law and know what to do, what's going on, what's the process, is really important. And I think public education is key. And part of that will come from word of mouth, I think. People who speak out about this law, sign up for it, write about it, tell others about it, tell their loved ones who they think might find it useful about it. I think, this law hasn't existed very long, and it's going to take a little bit of time before it's something that the general public knows a lot about and considers a viable option. So I also think that healthcare providers, specifically mental health care providers, could play a really big role in the implementation of this law. Mental health care providers could educate their patients about this tool and say, hey, I know that you have struggled in the past or seem to be struggling right now. This is an option to keep yourself safe. And make sure that you don't have access to firearms if a crisis comes up. And so I think that that's important. And then as far as people who are considering using the policy and taking advantage of the law, I think it's just important to ask yourself, do I find myself in periods of suicidal crisis often enough where I worry about myself when I'm well? Do I think my experiences with suicidality make me probably someone who doesn't want to have easy access to a gun? And I think if the thought of having easy access to a gun, being able to buy a gun really easily, scares you when you're well, then it might be in your best interest to take advantage of this policy, which I think is a really great way to give people agency to protect themselves. So I know that self-care is kind of a buzzword right now. We hear about self-care in all different forms, and it's honestly overused. But when I think about true self-care, I think about a policy like this, which is a policy that allows you to defend yourself from your darkest most suicidal impulses, whether you have a mental illness or not, whether you struggle with a substance use disorder or not. People find themselves in suicidal crisis for a variety of different reasons, and this policy allows you to preempt those dark urges and take care of yourself.
Absolutely. Well, want to thank you guys so much for being here. It's an important law. It goes into effect tomorrow, July 1st in Virginia. Let's educate the public, get more people to sign up and save lives. So Professor Fredrick Vars, Bryan Barks, thank you for being here. And I hope you guys have a wonderful 4th of July.
Thanks.
Thank you so much.